I'm Thomas George. I'm a family nurse practitioner, and I specialize in the evidence-based care of people with obesity. And I really pivoted hard. I did a lot of acute care and intensivist work. And it was after my own experience with obesity that I said, there's something missing here. I went from 185 pounds, lean, mean fighting machine when I was in the military. And after a traumatic brain injury, I was over 330 pounds. I was depressed, despondent. Nobody could give me answers. And they were telling me to do the things I used to do, exercise, eat right. And I was doing all those things, but it wasn't working. And it wasn't until somebody explained to me about the disease of obesity and what was going on that we started to actually attack the roots of my disease. So now with over 100-pound weight loss, I've got considerable experience on both sides of the exam table. So that brings me a lot of compassion. I love my patients, so I love hearing their stories. I want to find out what is their unique background so that we can find solutions that meet theirs. So I focused all my doctoral work on taking evidence into practice because I saw a gap. I saw that in primary care, where most people get exposed to healthcare, they're really missing the opportunity to learn about the disease of obesity and actually know which tools are effective for treating people with their different types of obesity. So,
how many patients do you have today, or you have taken care along the years?
well, I've taken all my practice focuses on obesity. So 100% of my practice are people who have either pre-obesity, obesity, or they're in maintenance. And I've done this when we were stationed in Maryland. I was in private practice there, and now I do this in Idaho. My clinic's a little different. My clinic looks a little bit like a fitness center instead of, say, your normal clinic. I wear athletic gear to work with my patients. I like to exercise with my patients. I cry with my patients. I laugh with them. I dance with them. It's always kind of fun. And some of my greatest patients are actually here today because they're not my patients, they're my friends, and that's a good thing. I approach most things with skepticism because I'm not only a provider serving people with obesity, but I'm a person living with obesity. And so when I hear things, I have been through so much. So I've lost over 100 pounds and I maintain that. But to do that, there are so many people out there that are shilling things that are really not good for people. It's only good for their pocketbook. So that's my background. I approach everything with suspicion. So what I do is I look at the evidence. My doctoral work really focused on how do you translate the evidence into primary care so people with obesity can actually get the help they need. So I started looking at the evidence. And when I look at the evidence for epidemy, it just stands out like, wow, here's something that's unique. What it makes it unique is that it's a medical device. It's not pharmacological. And I have so many patients who are looking, they're like, is there anything I can do other than a medicine? And this is something that we don't really have. So there's a gap. And I'm thinking, okay, here's something that fills that gap. And when you see the evidence, the safety profile and the efficacy and the grouping, that the indication for 25 BMI, this is a gap that's often missing. So then I go from skepticism to guarded optimism. And then I start researching more and I started reading the trials. And then when you see the actual outcomes data, and then from the next set of data, that elect data, it's like, this is a really powerful tool. The safety data is very compelling for me. I love something that's convenient and portable for my patients. And selfishly, I'm like, I need to try this myself because I'm always looking for a tool. I guess I'm an N of one. I'm always experimenting on myself first. I don't like to advocate for my patients if I haven't either investigated it or if I haven't tried it myself. But I'm excited. I'm super excited. I just traveled to a conference where I had to carry a refrigerated bag of my medicines, and I had to get a hotel room with a refrigerator, and that was a challenge. And now I have something that potentially I could slip into my pocket or my jacket. That's kind of cool.